We've seen some interesting data and research this month. Stories that influence workplace safety, environmental health, and sustainability. This month, we are spotlighting 9 stories. But each day, we curate and share the top EHS news stories from around the world in our EHS News app. Stories that directly impact our members, move the needle, are trending, or are just plain interesting. I'm Helen Clary, founder and leader of Viash Protary, and I'm sharing several Protary picks from January that we think you should check out. We start with some massive news from the Bureau of Labor Statistics. BLS just released 2024 non fatal injury and illness data. Total cases are down 3.1%, the lowest since 2003. But here's the nuance. This improvement is mainly coming from the illness side, not a sudden collapse in injuries. BLS shows illness cases dropped about 26%, and respiratory illness dropped about 46%, down to the lowest level since 2019. Meanwhile, injuries look pretty steady year over year. So when you benchmark your own program, break your trend lines into illness versus injuries. And looking at severity and prevention priorities, BLS also highlights that overexertion and repetitive motion are still leading drivers of DART cases. And exposures to harmful substances and environments are especially likely to require at least 1 day away. So that's a useful cue for where to focus: ergonomics, contact prevention, exposure controls. Not necessarily new information, but good reminders. A quick compliance tip: your OSHA 300A log should already be posted. And if you're required to submit to OSHA's injury tracking system and haven't, don't delay. Submit now. The system always gets bogged down as we approach the March 2nd deadline. You don't let a technical glitch be the reason for a late filing. In OSHA news, OSHA published a new letter of interpretation. The scenario: an employee brings an e-cigarette rechargeable lithium-ion battery to work. They carry it in their pocket, unprotected, a fire sparks, and they get burned. Is it work-related and reportable? Short answer: yes. They weren't eating, they weren't grooming, so it doesn't meet the exceptions. And the bottom line, it meets geographic presumption because it happened at work. So this may seem frustrating, maybe confusing because it wasn't caused by a work task, but recorded injury and illness data is not supposed to reflect employer failures. It should help identify risks. In this example, educating employees on lithium-ion batteries would be a smart move. Federal OSHA also launched the Safety Champions program. It's a 3-step self-paced program that will help employers develop and implement effective safety and health programs. You can also request support from a government safety champion. So check it out and get some free support. Moving into environmental research, there's a bit of a mystery unfolding in the subarctic. A study featured by the Harvard School of Engineering found a 60% decrease in PFAS levels in whale tissue over the last 2 decades. And while that sounds like a win, it's actually a bit of a scientific puzzle. Global beef PFAS production is rising, yet it's not accumulating in the open ocean as expected. As the lead researcher Elsie Sutherland put it, the ocean is usually the terminal sink for human pollution. So it's not in the whales and it's not in the open water. Where is it? This suggests that PFAS compounds might be behaving differently in the environment than the forever chemicals that have been studied for decades. We also saw a critical study from UCLA regarding wildfire aftermath. We often focus on outdoor air quality during a fire, but this research shows that significant volatile organic compounds, VOCs, remain trapped inside homes and on personal items after the smoke clears. Just good information and reminder for those living in Southern California and professionals involved in the cleanup and rebuilding from the last year's devastating fires. And for a bit of perspective, our 5th story is a powerful investigative piece on a small mining town in British Columbia. It operated for 40 years as a town literally built on asbestos, where the dust was so thick in the factories that sometimes the workers couldn't see their own hands. It's a sober reminder of how far we've come in exposure control and understanding, and it's a great read for anyone who wants to understand the historical weight of asbestos and just regulations that we manage today. On the organizational side, a study highlighted by Forbes found an interesting link between leadership and safety. U.S. companies with at least 2 women executives were 14.3% less likely to have workplace safety violations. Even more interesting, when violations did occur, the penalties tended to be less severe. In world news, a new law in Canada requires AEDs at construction sites. In response, ResCon and Smart Safety Solutions put together a comprehensive compliance guide that covers everything from placement to implementation strategy. And even if you aren't in Canada, and especially if you are subject to California's AB 365, the Just in Crop Safety Act that became law January 1st, you should grab the guide. It's a great blueprint for how to implement AEDs on a site. Finally, a bit of positive news from the EPA. The agency has announced a goal to eliminate all animal testing by 2035. This is a massive pivot that started back in 2019, but it was paused and now it's being reactivated. They've even launched an adoption program for lab animals. A lab rescue beagle named Oliver was present at the signing. It's a sign the agency is moving toward more advanced in vitro non-animal testing methods that are often faster and more accurate for modern chemical screening. Advocates are encouraging other federal agencies to follow suit. So we'll see what happens there. Okay, those are some of the Pro picks and trends for January. Find the links in our post. The news cycle moves fast. Our members receive all the latest news every day. If you want to stay ahead and get more curated updates tailored for EHS leaders, reach out and learn more about the OSH Protary and our EHS News app. You can also follow us and subscribe so you don't miss important information that we share.